Well, good afternoon, everyone. Welcome to our daily COVID-19 update briefing. I'm joined today by Dr. Amal Tokars, our Assistant Director at the Illinois Department of Public Health, Dr. Omer Badaman, Director of Infectious Diseases for Memorial BJC Hospitals, Margaret Blandford, the Deputy Director of the St. Clair County Health Department, and Herb Simmons, Director of the St. Clair County Emergency Management Agency. We're here in Metro East. Two of our senior elected leaders are here also with me. I want to thank Chairman Mark Kern of St. Clair County and Leader Jay Hoffman, who has been a great partner in Springfield in helping to protect the people of Illinois 19. So let me start with some in the testing department. Illinois is now averaging over 70,000 tests per day. And as of this morning's report, we now have more than 7 million totals since the beginning of the pandemic. A milestone reached just 2 weeks after we crossed the 6 million mark. That means here, like in many other states, there is a test available to you at no cost if you need it. Find the testing center nearest to you at dph.illinois.gov/testing. I'm going to say that one more time because I do want you to go there and find out where you can go to get a COVID-19 test. dph.illinois.gov/testing, and you can address in and find the nearest location to you to get a test. We gather today as Metro East's neighbor to the east. Region 5 enters a period of stricter mitigation in response to a surging positivity rate, now at 9.1% as of this morning. This comes as Region 5 saw a sustained rise in COVID-related hospitalizations for nearly 2 weeks. These mitigations are not fun for anyone, but they're meant to protect people, support our healthcare workers, and save lives. Just like stoplights and seatbelts make our roads safer for everyone, or banning smoking from airplanes and restaurants when science demonstrated the harms of secondhand smoke. So many times throughout our lives we are met with challenges, and from seatbelts to signage, we find ways to manage and to overcome them. This pandemic is the greatest challenge that many of us have experienced in our lifetimes. And when it comes to managing this pandemic, these are our best tools to find our way through to the other side. As more and more studies continue to show, this virus is primarily conveyed through respiratory transmission, person to person, and situations where people are more likely to see that transmission, singing, talking loudly, talking without a mask, take on a greater concern when we're seeing high rates of community spread. These mitigations aim to cut down on those high-risk activities until we can bring down the positivity rate in any given area. It's really that simple. We want to restore as much normalcy to people's lives as possible. But that can keep it there. The way we do that is to create a safer, more open landscape so long as we're living in this pandemic. That's how we keep our economy moving forward and get more of our kids. And to reduce the impact on our bars and restaurants in the meantime, our Department of Commerce and Economic Opportunity is giving priority consideration to small businesses in regions that have earned additional mitigations in our business interruption. And you're a bar or restaurant or a business that's been affected by the resurgence mitigations that have been applied, you can EO website apply for a business interruption grant, and we will prioritize. I say all this today because here in Region 4, things have moved once again in Metro East, because I want to make sure all of you know that didn't happen on its own. That this community put in the effort to make that happen. Unfortunately, an average of 5.8% at average positivity rate, 2 full percentage points in as many weeks, and it's rising. In other words, Metro East, it's time to step up and mask up. The work is not yet over. Nobody wants to go back to tightened and heightened mitigations. We have our elderly, our immunocompromised family members, our frontline workers, and our healthcare carrying an undue burden of risk. We have got to get this under control. Before I turn over the podium, I want to provide a brief update on the metrics of Region 1, northwestern Illinois, where Rockford is, where Freeport is, which has been under Tier 1 of our resurgence mitigation plan since Saturday, October 3rd. Over the last few weeks, Region 1 has continued to see a surging positivity rate, 11.9% as of this morning. We've said all along that if things don't turn around in a region after 2 weeks of resurgence mitigation, to add more stringent measures to help usher in the progress that we need to see more open again eventually. That is now the case in Region 1, which has seen its positivity rate rise nearly 2 percentage points since October 14th alone. So starting Sunday, northwestern Illinois will need additional mitigations, such as tighter gathering caps of 10 individuals instead of 25, and new restaurant and bar table caps of 6 instead of 10 when eating out. The existing mitigations that were already put in place in early October will remain also. Both Region 1, bordering Wisconsin and Iowa, and Region 4 here next to Missouri, carry the additional responsibility of navigating a situation where the massive surge of cases in our neighboring states will continue to have a spillover effect. There is no easy fix to this. So as colder weather comes upon us and brings flu season along with it, it's imperative that we take extra caution and extra care. Because at the end of the day, this is bigger than you. This is about all of us and the communities that we call home. Wear your mask, watch your distance, wash your hands, and get your flu shot. We have to. Over to Dr. Amal Tokars, again, the assistant of the Department of Public Health.